Good morning, professors. I'm Fu Peng from the Third Hospital of Peking University. I'm here to present this topic for Dr. Cui Ligang, because he was quarantined for 2 weeks. His topic is contrast-enhanced ultrasonography in peripheral nerve tumors. First, let's review the classification of peripheral nerve lesions. There are two main types of lesions here. One is peripheral nerve tumors, including benign and malignant peripheral nerve shear tumors, intraneural ganglion, intraneural hemangiomas, and neurolymphomatosis. Another type of the PNST is the peripheral nerve tumor-like lesions, which includes traumatic neuromas, which also we called Morton's neuroma, and lipomatosis of the nerve, intraneural ganglion. Ultrasound has been shown to be an excellent method to access peripheral nerve tumors and tumor-like masses. First of all, we can have a dynamic scanning during the examination, and we can use the bilateral comparison. And ultrasound has the best spatial resolution, and we can scan off the entire longitudinal course of the nerve. So, what's the main ultrasound criterion to diagnosis a nerve tumor is confirming continuity with the nerve bundle. And there are some tips for scanning technique. We usually use the short axle, and we move the probe slowly from the normal side to the mass, and we can feel the probe is slowly raised. We call it the elevator movement. Now let's talk about the ultrasound findings of common peripheral nerve shear tumors. Schwannoma. It is arised from new nerve shears, predominantly eccentric in relation to parent nerve. Neurofibromas. It is arised from the peripheral perineural cells, not encapsulated, predominantly central in relation to parent nerve. The most common ultrasound imaging feature is string sign, which means entering and existing nerve roots are visualized at the both ends of the fusiform mass. It's a bit like the beautiful pearl necklace. And another sign is the target sign. It refers to the central hyperechogenicity. It refers to the hyperechogenicity, which might mean the high collagen content. The third common sign is split fat sign. Split fat sign, a high apoechoic rind of fat surrounding the lesion, is a bit like the little red hat. Furthermore, there are some differences between schwannoma and neurofibroma. Schwannoma are usually solitary ovoid mass, non-aggressive features, slow growth. Small size, no gender predominance, most in 20 to 30 years of age. Histologically, there are two types. Antony 1 means hypercellular, and Antony B, myxoid tissues, high water content. We also call it cystic schwannoma. Neurofibromas are fusiform, centrally growing mass mixed with neural tissue and not separable from it. No gender predominance, 20 to 30 years of age, superficial cutaneous nerves, painless. Myxoid areas are not as predominant as they are in schwannomas, commonly extended beyond the epineurium, although they remain circumscribed. So when there are no typical ultrasound appearance, how can we make the exact diagnosis? This happens in the following situation. The parent nerve ends are too small, it's hard to recognize nerve, or difficult to establish the relationship between the mass and the nerve, or pseudo-string sign which caused by the near fissure. In this circumstance, CEUS can help. We usually use Sonoview 3.5 milliliters bonus inject. Here are two samples. This is a male patient, 43 years old. He found a tumor in the left neck in routine examination. We can see here is the oval tumor with clear boundary, no string sign, and with poor blood flow. Then we injected the microbubbles. Here they come. We can see the central part of the tumor is significantly enhanced, and there is a ring of few bubbles, looks like a target sign. We can call it the CEUS target sign. The second case was a 41 years old female with ankle mass for 10 years. The images shows is an oval tumor with clear boundary, and most of the tumor is hypoechogenicity, but we can see some hyperechogenicity in the central part of it. We can call it a target sign, but we cannot find the split fat sign, and there is no string sign. And we used the microbubbles to help. Here the bubbles are coming. We can see the bubbles comes to the central part and split to the peripheral area. At different times, obvious enhancement can be seen in the central area of the tumor, but the peripheral area is poorly enhanced. Pathological examination showed both the tumors are schwannoma. Finally, ultrasound has advantages over other imaging methods, including high spatial resolution and dynamic capability. Typical characteristic ultrasound imaging findings allow specific diagnosis of peripheral nerve tumor and tumor-like mass. Central early hyperenhancement is a useful CEUS findings of PNST. We call it CEUS target sign, but still we need more clinical study. That's my report. Thank you very much for your attention.